What is the speech path? That's sort of a loaded question. Maybe I'll start the answer with telling you about last Thursday. Last Thursday, we woke up to a dreary, rainy, overcast day here in Middle Georgia. Some of the rain and moisture and wind was coming up from a tropical storm, and it was just ugly outside. Everyone got to work a little bit damp, a little wrinkled around the edges, but got to work. You know, we're here to work. So as our day went on, we began to notice that we didn't really hear so much the raindrops or the thunder off in the distance. What we did hear were the squeals and the giggles of the little kids running up and down the hall because they were glad to be here. They were enjoying themselves and they were comfortable. You know, the speech path is a lot of things, but one thing that we strive really hard to be is that. We can do that, and we do that. We provide that sort of environment where people can relax and be happy and learn. Textbook-wise, the Speech Path is a company that provides speech therapy services along with occupational and physical therapy services to children and adults. That's a mixed customer base, to say the least. We have one common waiting area, and it's not uncommon at all to see little children wandering around the halls or sitting right next to an adult who may be in for speech therapy as a result of a stroke. Maybe it's a Down syndrome child who is here for occupational therapy to help them prepare for school. The speech path does a lot of things. But one thing that we know we want to continue to do and we strive to do because we feel like it's vitally important to the progress of our patients and to the health care as a whole is to always be conscious of the fact that we have control over someone's day. That takes a little bit of the sting out of coming to work on a day like last Thursday when it's raining and it's yucky outside and we would much rather be at home in bed or sitting on our sofa curled up with a blanket reading. But then we think about the little patients, the little children, or even adults who come in and they can't read. They can't pull themselves up on a sofa or curl up in a blanket because they don't have that sort of muscle control. You know, one of the beauties of coming to work every day at the Speech Path is I get to see pure joy. Sometimes it doesn't walk in the door that way. Sometimes a patient can come to us and they're a little disgruntled because they didn't sleep well or they aren't feeling well or they're particularly frustrated. But we have the power to make a difference there, and we do. It's incredible to pull up in the parking lot and see a physical therapist playing in the grassy area next to our building, playing chase with a child while the child giggles and runs after that therapist while ponytails and hair and ribbons are flapping in the wind. You could watch a speech therapist get teary-eyed over a physical therapist reaching a milestone with a patient, a 17-year-old walking down the hall with no support for the first time in 18 months since he had that unprompted and still mysterious seizure that created such a hardship for him and his body. You might see an occupational therapist sitting cross-legged on the floor, not even worried about that streak of paint in her hair as she sits getting really messy with finger paints with a little 6-year-old boy. Boys love that. And then it's not uncommon to see one of our office staff step away from her desk. Maybe she's just on the way down the hall to hand someone a piece of paper and gets distracted gets distracted by what she's seeing in a therapy session. To see a child interacting so successfully and comfortably with a therapist who has such heart and such care about what she is doing, it's a game changer. It can change the course of a day, and for some it can change the course of a lifetime. Isn't it enticing to hear this? Isn't it exciting to know that these sorts of things happen in buildings just like this? In small towns and in little middle Georgia areas, little town called Perry, Georgia. That's where the Speech Path is. We're not in some big metro area, but we service about 400 children and adults each week between our two locations. That's a lot of opportunity to do a lot of good. Now, one other service that we provide is called FEES, F-E-E-S. It's an acronym. It stands for Fiber Optic Endoscopic Evaluation of Swallowing. Now, that's a pretty fancy word for a swallow study that is done bedside. Our therapist takes our mobile equipment into a nursing home or a long-term care facility and is able to evaluate the swallow function of an aging adult. Now, it's a pretty scientific name, but what it means for a layperson is that adult, maybe there's some anxiety related to having a test done. Maybe there's anxiety on the family's part because they don't live nearby. Maybe they're one state over. But the therapist can bring that equipment to the bedside, and there's very little disruption to the patient. For those patients who get easily disoriented because they're not accustomed to leaving their bed very often, they're not accustomed to leaving that familiar surrounding in the nursing home and those familiar faces that they know. It's a blessing for us to be able to go out and do those bedside tests that will enable the speech therapist within that facility to make good recommendations in terms of feeding and the food that patient can eat with so little disruption or discomfort for that patient. But it's another way that we have the ability and enjoy the ability to make it better for somebody. We do what we have to do. We create plans of care. The therapists work really hard to set goals for these patients that will challenge them and push them toward success, that will push them toward being able to communicate independently, walk independently. Maybe a child will go into kindergarten being able to hold their pencil. But it's beyond that. What the Speech Path does is beyond what is documented in a plan of care. Wouldn't it be comforting to know that your health care provider was doing more than what was just written on a piece of paper? Wouldn't it empower you to reach the goals on your own and work hard and continue your own plan of care, even outside the confines of that healthcare office? If you knew that there was someone on your side, there was someone on your team who had your back, who was going to encourage you and push you to do your best. You know, one way that we work hard to foster that mindset of self-improvement is not only with our patients, but with the caregivers of those patients. We decorate our office in a way that feels homey and encourages positive and heartfelt connecting relationships. You know, the way our office runs is a patient comes in for therapy the same time every week. Little Susie comes at 2 o'clock on Tuesday for physical therapy, and then at 2:30 she goes to see Miss Lori for speech therapy. And that's her routine. So as mom or dad or grandmother or whomever is sitting out in our waiting area, oftentimes they're sitting with some of the same people that they see every Tuesday while they come for their own therapy session. So it's important to us that even that is a pleasant experience, because what we find is very not deliberate way, but support groups come out of this kind of setting. We find that they lean on each other and they're bouncing ideas off each other about how to find success at home. They exchange phone numbers, they exchange email addresses, and what we hear is that they enjoy each other's company outside our office. It's very difficult for a family with special needs to find the kind of support that they need. They need as a family unit, and they need as the primary care providers for symptoms and for a diagnosis that sometimes is very difficult to understand. It's just a very small thing that we can do, but if we can provide an area, a common area of comfort and ease that would encourage those relationships to develop, and then encourage those relationships to remain intact for years in a very supportive way, then we've done a good job. That's the way we feel about it. Could millions be blessed by this kind of healthcare experience? We think so. We believe so, yes. We believe what we do, good or bad, is paid forward. How many times have you left a very frustrating experience at the grocery store, for example? You get in your car, you call up your friend or your sister or your mom or your brother, and you say, "You're not going to believe how rude that lady was at the checkout." Well, the same thing happens in healthcare. We've all been there for sure. We rush to make a 9:30 appointment, and then no one even utters our name until about 11 o'clock. It's very frustrating and can begin to feel disrespectful. So it's our belief that if we work hard to present the experience, then much more will be accomplished than just what happens in the therapy session, back in the therapy room with the patient. When we say present the experience, we truly mean the word present as a verb. That's an action word. So we are very deliberate in the actions that we take to make the experience absolutely fantastic. It's unacceptable to us for someone to come in and be uncomfortable, not know where the restroom is, not know what the name of their therapist is, not know where their child is going to be for the next 30 minutes or even an hour, not know what they're doing in the room. That creates a level of anxiety, and then the unknown is what sometimes can spur some difficult situations and some awkward moments that might create the need for someone to feel like they might need to act ugly. Well, we know that we're an example, and other families are here. So there's just no need to put people in the situation that would make them feel like they have to reach for higher emotion simply to get served well. So, as we think about this term, presenting the experience, it's a full body, full family, full company experience in our mind. We work hard to make sure the patients are comfortable. We work hard to make sure the caregivers are comfortable. From a company's perspective, we also work hard to make sure that our therapists feel so equipped to execute the clinical skills they have worked so hard to perfect in a way that promotes ease and confidence in their ability, whereby promoting that experience, that works to present that experience. Certainly if a therapist is frustrated about something, it's going to come out. It's going to come out in their demeanor. It will come out maybe in their attitude, maybe simply in the way they sit in the chair or walk down the hall. It's important to us that everyone who maintains a presence in this building understands that we are all a team. We all are working for or working toward that experience that promotes growth for everyone here. As I mentioned a few minutes ago, the seating area, the common area, the waiting area in our office is arranged and decorated in such a way that feels homey and comfortable. There's furniture. It's not a metal chair with a rubber seat. It's a chair with a cushion and a pillow, and we have pictures on the wall. We have curtains hanging. It's homey, and it smells good, and it's clean. So oftentimes, very often, it's time to refurbish the waiting area because all our little friends with little walkers and little wheelchairs, little toys, little sisters, little brothers, everyone is welcome, but we know that there's a significant amount of wear and tear that happens to our lovely waiting area because of that. But that's okay, and we don't mind sprucing up every now and then. So we did just that a few nights ago. And the next morning, our 9 o'clock patient walked through the door. She put up her little 4-year-old palms. She walked in the door and said, "We redecorated," in the most precious, most dramatic voice I think I have heard in a very long time. You know, to see her level of happiness certainly was impressive. But her little words, her choice of words, stuck with me all day. She's right. We redecorated. We're in it together. We believe that we are a part of the team. We are part of that family. And we strive and desire for our families to feel like they are a part of us. So we're going to continue to present the experience. We're going to keep on redecorating, and we're going to toss up our hands and be happy when we do it. Isn't it about time? Isn't it about time we redecorated healthcare in a way that inspires confidence, competence, and every feel-good emotion that should come along with getting better?